Hello dear dentists, it's table clinic number 6 presented by GCD students. So before we get started, we need to talk briefly about GCD. GCD is a global Citizenship in Dentistry program which has started in 2019 in many universities around the world, and Faculty of Dentistry Mansoura University has been selected to represent Africa and Middle East. It aims to peer learning and educate students how to prepare portfolios, and certainly take their operative experience a step further to proceed learning about different types of restorations. Then let's talk slightly about operative dentistry and how it's such a magic tool to restore the teeth. It's the art and science of path diagnosis, treatment, and prognosis of tooth defects to obtain proper tooth form, function, aesthetic, and maintaining the health of surrounding structures, and of course preserve the health of interdental papilla. Now, the procedures of any restoration will flow into some steps. First, to get a detailed medical history of the patient, then to know patient's chief complaint in order to avoid any unnecessary procedures. Thirdly, proper diagnosis, then to what valid treatment plan, also that plan should be affordable for patient. The treatment itself, then refinement and awareness, finally constant follow-up to check and make sure everything is okay. First, we will handle composite restorations. Composite wasn't as popular, but now with new advances, it becomes stronger and can be used wider, especially when it comes to aesthetics. In this case, it can replace biological tissue, both in appearance and function. And in this presentation, we're going to delve into the procedures of Class 4, Class 1, and Class 2 using composite. And that's it, an overview of what we're going to handle. First of all, let's talk about Class 4, which includes the incisor edge with proximal surface. The instruments we use are as follows: catalyst, putty index, handpiece of high speed, fisher bar, tapered bar, wedges for teeth separation. And let's get started with procedures. First, we need to take an index to record the palatal aspect of the tooth with proximal, so we can build up at the end. By mixing 1 spoon of putty with appropriate amount of catalyst and make a ball, then adapted into the tooth surface, smoothen down and remove. And of course, for preparation of that index, we need to cut the excess to avoid any interference afterwards. Then, we mimic Class 4 fracture on the right maxillary incisor using handpiece, of course. For shade selection, it's recommended to do it in natural light before delving into any other procedures to obtain the perfect shade to get optimal aesthetics. Finally, some pieces of advice: during tooth preparation, lay the handpiece better be at 45-degree angle to the external tooth surface. And during preparing for bevel, its width should be from 0.5 to 2 millimeters. Bevel is essential to hide any line of demarcation between the tooth itself and restoration. Fast forward into rubber dam procedures associated with etching and bonding. For that, we need rubber dam forceps, bunch, premolars clamps, rubber sheet heavy, dental floss, and template. And the isolation is done as follows. For determining the location of teeth using template, we can use the punch to make holes into the rubber sheet guided by template. All that corresponds to the teeth that should be isolated. Then adapt the sheet to the teeth with helping of dental floss to be tightly fixed, and seating the clamps using the forceps, of course. For etching and bonding, we will use acid etch of 37% concentration of phosphoric acid in form of gel, bonding agent, Teflon tap, and micro brushes. We apply the acid etch on enamel for 30 seconds and on dentin for 15 seconds. Rinse it away and dry it up gently to get a chalky appearance of tooth. Applying the bonding is the next step using micro brush and protect the neighboring teeth using Teflon and light curing for the teeth being prepared for 20 seconds. For composite buildup, we will need composite resin of previously selected shade, composite applicator, light cure, and sectional band. Firstly, we will use the index for palatal surface buildup using the composite applicator, then adapt it to the tooth and curing for 15 to 30 seconds. Then, place the sectional band to isolate the neighboring tooth and build the mesial aspect, then light curing to it too for 15 to 30 seconds. After that, build the facial aspect of the tooth by applying a layer of composite, then cure it too. But take into consideration that light cure is done for all aspects for 15 to 30 seconds. For finishing and polishing, instruments we will use are handpiece, high and low speed, abrasive strips, needle pair, polishing diskette, polishing pair flame-shaped, articulating paper, and polishing brush. Using abrasive strips in S-shaped for contouring the proximal surface. Make the facial surface highly polished by removing any excess of composite using handpiece in finishing discs or pairs. Make sure to check the occlusion using articulating paper, and whenever you find excess you can spot it and remove it. Using the polishing discs and brush to smoothen the surface of tooth and give it natural appearance. Then, final check for anatomical and natural shade is done. Now, let's talk about Class 1 composite restoration. For the instruments, they are the same as we use in Class 4, and the steps will split into Class 1 cavity preparation using rose head pair for pets and fisher pair for making the cavity itself of 2 mm thickness. Same rubber dam instruments for isolation, and same materials for etching and bonding. Using phosphoric acid of 37% concentration for 30 seconds on enamel and 15 seconds on dentin, and rinse it, then dry it up. Bonding is also applied by micro brush, left for 20 seconds, and must cover all cavity walls. Then light cure for 20 seconds. For finishing and polishing, we need the same instruments as Class 4 as well. And for composite buildup, first, we should build each cusp using layer by layer of composite, and each layer should only be of 2 mm thickness. Secondly, we have to make sure that there are no air bubbles between tooth structure and composite. Thirdly, light curing for each layer following manufacturer instructions. The polishing instruments are the same as well. Fourthly, polishing for obtaining smooth surface. Into Class 2 composite restoration. Instruments will always stay the same, and the procedures will flow into number 1, Class 2 cavity preparation by making Class 1, then use band to protect the neighboring and prepare proximal surface, and same rubber dam instruments. Number 2, isolation is done using rubber sheet and molar clamps, this time with frame 2, and as always using puncher to make holes into the rubber sheet. We will also use sectional matrix to obtain anatomical proximal contact. And the same etching and bonding materials too. Step number 3, etching is done by applying etching gel on tooth walls of total 30 seconds for enamel and 15 seconds for dentin, then rinse and dry it up. For bonding, is applied by microbrush and light cured for 20 seconds. Materials stay the same. For building, we need to start with proximal surface, transferring it into class 2. Then light cure for that layer, and follow cusp to cusp. Same finishing and polishing instruments do. For finishing, we need to make sure that we obtain smooth surface and normal anatomy of the tooth. Also remove any excess or irregularities and make sure the occlusion is accurate all the time using our articulating paper. Polishing is also essential to gain lustrous and normal appearance of the restoration and also restore the aesthetic appearance. Lastly, we can freely talk about amalgam. It has been used for ages and is strong enough and can be used in posterior teeth. It doesn't support aesthetics and may undergo corrosion after a while. And here is a video illustrating amalgam restorations. Finally, here is a little comparison between composite and amalgam to summarize everything up. First thing, composite and some of its advantages: aesthetics, conservation of tooth structure, insulative, bonded to tooth structure. And some of its disadvantages are polymerization shrinkage, difficulties during finishing and polishing, technique sensitive, time consuming, and expensive. Secondly, amalgam. Some of its advantages are economic, ease of use, long-term clinical results, self-sealing, and can be bonded to tooth structure too. And some disadvantages are lack of aesthetics, lack of conservation of tooth structure, and corrosion and galvanism. Now, feel free to take a look at our work in the following slides. And here is 3D model of tooth being prepared for Class 4 Composite. Last thing we will discuss is blogging, and it's one of the main things in GCD, where you can show your work up on the platform and receive comments from other colleagues, and of course you can reply to them too. That feels so much supportive and engaging at the same time. These are some examples, and you are welcome.
About the reasons why we joined the GCD program. First, because learning more and more about dentistry is important to be a qualified dentist. We wanted to have challenges with other students from several countries and be in contact with them. We wanted to keep up with operative dentistry new trends.
I joined GCD program because fair learning is essential for us as students. I believe that we should improve our communication and presentation skills, and for knowing more about dental photography.
Lockdown was the only problem we encountered, but we solved it as we were trying to finish our tasks using the available facilities. Online demonstrations and workshops helped a lot.
It was a great pleasure to join GCD program. It helped us to learn more and more and to improve our soft and hand skills. We learned more about Composite, its parts, its pros and cons. We met different colleagues with different cultures all over the world and share our experiences at GCD platform. Also, we learned about dental photography and its importance in marketing that will help us in the future.
Some benefits we get from the GCD program that we improved our presentation skills, as well as through peer learning and scientific blogging, we learned constructive criticism. And last but not least, teamwork through preparing our table clinic.
At the end, I'll encourage every student to join GCD program, as I have learned a lot and got a great benefit from this program, and I wish you the benefit also.